thank you for joining us for Therapy Chat with Phoenix Behavioural Health. I'm Dr. Dawn Parks, and with me is Christine DesLauriers, LICSW and addiction specialist. Today we are going to start to talk about personality disorders. There are a lot of personality disorders, so it's probably going to stretch out over the next perhaps 3, possibly 4 sessions. The personality disorders start to develop at a very young age, so they're very pervasive, and they've been put into different categories depending on the main traits of that personality disorder. So for a little bit of an overview about what a personality disorder is, we can look at graphic number 1 about the disorders, and as you can see, it's an enduring pattern of inner experience and behavior. For example, in early childhood, it's quite normal for a young child to be very fearful and shy and want to stay close to their parents. But typically a child will grow through that, develop through that. With a personality disorder, we see this same trait continuing all the way through into the teen years and to the early adult years. So it's more of a lifetime type of a situation. So the pattern manifests in 2 or more of the following areas, as you can see on the graphic. So number 1 is thinking. Right? Thinking patterns are distorted. They tend to be very rigid, and thoughts tend to be very extreme thoughts. 2, feelings. There's typically problems with emotional responses, very, very intense, strong, fast emotional responses. C, interpersonal relationships. We're looking at difficulties with other people. And again, everyone has difficulties with some people, but in a personality disorder situation, we see that there's a lot. It's not just the people at work who are difficult, it's the people in my family who are difficult, the neighbors are difficult, the community. You keep seeing that same thing coming up. And the last one is impulse control. So often we'll see a lot of behavioral issues, maybe getting into a lot of fights and arguments or breaking things like that. Very difficult to, once there's a feeling there, to be able to manage it and calm it. Number 2 on that graphic, this pattern deviates markedly from cultural norms and expectations. So we're not talking about someone who is from a culture where perhaps being somewhat dependent is okay, right? That would be a culturally specific trait. So we're not talking about anything cultural. The pattern is pervasive and inflexible, very rigid, very difficult to make a change. And often for a person who is personality disordered, they don't see that rigidity and inflexibility of behaviors and thoughts is an issue. It's typically looked at as if it's everyone else who's being inflexible and rigid, and it's not me. And that's often the reason why we don't see as many people as there are with this issue, because they don't often find their way into therapy. Certain personality disordered individuals may, but for a lot of the ones that we're going to talk about, they don't, and they perhaps get into therapy either because there's a comorbid substance abuse issue, or there's some criminal involvement and they're required to attend. And then when we're working through that issue, then we start to see the personality issues coming up, and we can start working with those. As I said earlier, it's pervasive. It's stable over time. So, if when we ask when we're in session, is this a new behavior, and a person says, well, I just started about a year ago, that's probably not a personality disorder. It's typically been there as a teenager. It's been there for a long time. And it can lead to a lot of distress or impairment. It could lead to those issues for the person themselves, or in other cases for the people who are around them, and how their behaviors are affecting the people that they interact with. So these personality disorders have been placed into certain categories. So we have one category that deals with what we term as odd, unusual, or eccentric behaviors. Then we have another that is dramatic or emotional disorders. And then a third category that talks about the anxious, fearful disorders. And that's a category that we're going to be talking about today. And in that category are what we call dependent personality disorder, obsessive compulsive, and avoidant. So those are the three that we're going to at least start to talk about, and hopefully we will be able to talk through all of those. And I'm putting up graphic 2, which looks at the diagnostic criteria for avoidant personality. So the criteria are put together and a part of what we call DSM-5, Diagnostic Statistical Manual, that therapists and psychiatrists use to help form a diagnosis. So I just want to make one point that if you are reading through this graphic, or you find this on a DSM-5 or on the website, to just be very careful regarding self-diagnosis. These are the criteria to meet, but there's a lot of other things that are involved in this. So, if you have questions about it, you could ideally, make an appointment with your therapist, say, I was looking at this, what do you think? And then he or she will work through you with that. But as we're looking at avoidant personality, everyone can look at this probably and say, oh, I do that. That sounds like me. But it's important to remember that this is more often than not these criteria, right? It's not just sometimes, it's almost all the time that this happens to me, or that I respond like this. And I also need to meet at least 4 of the criteria to meet the threshold for diagnosis. So we look at number 1, unwilling to get involved with people unless I'm sure of being accepted. 2, shows restraint with intimate relationships. 3, preoccupied with fears of criticism or rejection. 4, inhibited in new interpersonal situations because of feelings of inadequacy. 5, it's a sense of inferiority or not as good as. And 6, I'm usually reluctant to take personal risks or to engage in anything new because it may be embarrassing. So I may, but I need to be really almost 100% sure that it's going to work out and I'm going to be accepted. So, Christine, do you have many people who you've been working with exhibiting the avoidant personality traits?
Yes, I think you related that to anxiety. The anxiety cluster sort of traits that we're going to talk about, and I think it is important that what you said at the beginning, not to overly diagnose yourself. A lot of people can relate to aspects of these personalities and have some traits of them, but that doesn't necessarily mean they have the personality disorder. It really it has to do with duration. As you said, we're talking about things that were happening in childhood and are still happening. So it's not about something that's a recent event, but I do have clients that I think will be reluctant to engage in personal relationships and as well as work relationships because of their avoidant personality disorder. So that, the problem with some of these disorders is that they cause emotional distress that interferes with daily functioning. So it becomes a real problem when you have to maintain a job or you have to have income. How can how can you do that if you don't work well with other people? So it can become a real problem.
I think a personality disorder can take some time to actually identify. Sometimes certain ones are more obvious, but I think with avoidant it may be a little more difficult because the person's avoidant anyway. So how do they come into therapy in the first place? And it's so important to be because that client is going to probably feel that you're thinking negatively of them and you're not going to accept them. So it may be hard, one, for them to come in for that initial appointment, and two, they could very easily, by a word that may have been taken as being negative, for them not to come back or to have difficulty keeping that person in. So it's really, really important to have that strong feeling of acceptance, if you want.
A lot of the personality disorders, and some of them, that we'll get into down the road even more so, as you mentioned, they don't come into therapy unless they're coerced in some way. And if they do come in, generally they don't stay in therapy. They're very short-lived, and they'll come for a few sessions and then they stop. It's hard to keep them engaged. It's hard for them to stay engaged.
And I think a point to make out is that with an avoidant personality disorder, a client's often viewed as either being perhaps a very shy person or a very standoffish person. So that person is in a situation where they're thinking, I'm not going to be accepted, and then the vibes they give off are kind of
like a self-fulfilling prophecy.
So they say, see, no one talked to me at that party.
Right.
And I think another reason we don't see as many avoidant personalities is because they're quiet. With a lot of the other personality disorders, there are issues that happen.
They can be kind of explosive, some of them. Yes.
So they draw attention. So the avoidant can easily get lost in that. But they can, although, it doesn't cause, you don't typically see legal issues, criminal issues. Substance abuse can be a big one because it helps with
disconnecting. And And work related. I mean, probably someone with avoidant personality, might come in because there's a work issue.
Right. I think they can suffer a lot because typically an avoidant personality wants to have a relationship. We'll talk next week about another personality disorder where the person doesn't have many relationships and doesn't want them. But an avoidant personality is generally suffering a lot because they want to be part of these relationships, but there's just so much kind of fear of being criticized and being unaccepted. So, again, we talked about last session, cognitive behavioural therapy has been found to be very helpful for working with these individuals, because it does start to look at what am I thinking about this situation and how can I
challenging some of the
change.
beliefs which are
Yeah.
very ingrained with these individuals.
Okay, so moving to our next graphic, we're going to look at dependent personality disorder. So there are 8 features to this. So this is a really excessive need to be taken care of. A person being kind of submissive. This person may have a hard time saying what they want or how they feel, or presenting their ideas. They can be clingy. A partner may come in and say they're too clingy, they can't do anything on their own, are very needy, and they're driven by this fear of abandonment. So it's very hard. So a dependent personality could get into relationships that may not be the best, but rather than break the relationship, the need for someone there is so strong that they'll get into this interaction with this person who sometimes can be abusive. A dependent personality tends to attract potentially abusive personality, and they stay in the relationship because they're so dependent. So some of the criteria here, well, there are 8 criteria, but again, we don't have to meet all 8. Typically it's 4 of them that we need to meet. But difficulty making routine decisions, requires others to assume responsibilities which they should be attending to. Fear of disagreement with others, difficulty starting a project without a lot of support from other people, excessive need for nurturance, vulnerability and helplessness if they're alone, desperately seeking another relationship, so they tend to, as soon as one ends, immediately get into another one without giving themselves that time, and being unrealistically preoccupied with being left alone and unable to care for themselves. It's this driving fear, what am I going to do? I'm not going to be able to survive, I'm not going to be able to be okay. So you can see that when someone has a lens through which they are looking at other people, their relationships, their work, their environment, it can be very, very scary.
I see a lot of dependent personalities. I see a lot of that in my work in substance abuse, because you mentioned the toxic relationships.
Yeah.
Typically, they're in these toxic relationships, and they can't seem to extricate themselves from them, set healthy boundaries, take care of themselves. They don't really attend to their own needs. They can't feel that they can manage on their own, and when they get out of one toxic relationship, they're immediately into the next toxic relationship. Sometimes there's not even a week in between the relationships, and it's this sort of inability to trust themselves in terms of making decisions and feeling that that they can be okay. I see that pattern quite a bit with substance abuse couples and individuals.
Yeah, and again, as a really good therapeutic intervention, an evidence-based practice such as cognitive behavioural therapy is being found to be very helpful, because it's helping the individual challenge these belief systems about, I'm not going to survive on my own, I can't make that decision, I always need someone there. They're able to start to challenge those thoughts. I think in therapy too, it can be a little bit of a challenge for the therapist, because the client who's very dependent may have a hard time saying what they think. If therapists ask, how do you feel about this, they want to please. So they can they can try to recreate this same relationship with the therapist, where they want to be told what to do and how to do it and when to do it. And so a challenge for the therapist is to be supportive, but also to help the client start to become more able to make their own decisions, and more self-confident and more independent.
Yeah, usually a lot of times they can't even identify how they feel.
Hmm.
They've never really thought about it, because they're too busy revolving around the toxic person in their life.
Yeah.
So,
And again, very often a dependent personality, like you said, doesn't see it. What they see is that the people around them are difficult, but they don't see that what their input is and what they're doing is problematic. And actually, research shows that although there are men with this, that it tends to be a lot more women with dependent personality.
and that might be a cultural thing, influence,
Yeah.
tradition, culture,
Yeah.
that
Yeah.
sort of lays the groundwork for that,
Yeah.
in a sense.
Yeah. So let's move on to the last one in this cluster, obsessive compulsive personality disorder, and this is on the next graphic. So there's a few criteria here. So impairment in function, self-functioning, right? Either identity is a sense of self that is derived mostly from work or productivity. I can tend to really kind of be 100% or overly identifying with how much work I do or how much I produce. And self-direction, difficulty completing tasks and realizing goals associated with rigid and unreasonably high and inflexible standards. Because if I have, let's say, a particular job at work to complete, it's going to cause some problems if I have to get it. I have to redo it and redo it and redo it because it's not perfect in a situation where it doesn't have to be perfect. When we're talking about minute details that probably most people would say that looks great, but we get caught up on those very, very small details.
I think some people confuse obsessive-compulsive personality with obsessive-compulsive disorder.
They do.
And there are a lot of the same behaviors.
Yes.
It's very similar,
Yes.
but the difference is they don't have the obtrusive thoughts that the OCD person has.
Yes.
So,
Yeah, and they don't have the compulsions, so they may get very very rigid and inflexible thinking, but there is a difference. And some people kind of get very upset with the diagnosis because they think, but this is not the same. The next one, pathological personality traits. Being into rigid perfectionism, insistence on everything being perfect. Right, so I can get into this mindset where I am just on this direction, and no one else is right, and I'm not going to.
No compromise, no flexibility.
No.
Right.
No. Perseveration. So I could get stuck on something, and it can be very hard to let go. So,
Trouble throwing things away too.
yeah.
And I'm not, I mean,
Yeah.
we all have our, issues with sometimes sentimentally keeping something, but this would be things that might be broken. They can't get rid of things like that.
Yes.
Things that would be, by most standards, termed trash or useless.
Right. There is not as much research into treatment of obsessive compulsive personality disorder as there has been on dependent and avoidant personality. Sometimes a person may be prescribed anti-anxiety meds, but it's still not known how effective that is, but really being able to sit with the person and help them look at this pattern and again, question and reevaluate and start to help them develop a little more flexibility of thought. But this can be a long process, but it,
I think most of the personality disorders, it's a long process.
Yes.
And you're moving the needle just a little bit on the scale. Most of them don't change dramatically.
Yes.
But you can, depending on how high end they are, you can move them a little bit.
Exactly. Well, thank you for joining us today. Hope you found some interesting facts about our dependent, obsessive compulsive, and our avoidant personality disorders. And next week, we'll be talking about Cluster B, dramatic and emotional personality disorders. If you have any questions, thoughts, anything that you would like us to especially discuss, please let us know. We can be reached at drparks@phoenixinfo.online, or you can call us at 508-623-3931. Thank you for joining us.
Thank you.
We'll see you next week.